Well, welcome and thank you so much for tuning into this lecture here today. The title is Diabetic Retinopathy, Imaging in the Future. I'm Carolyn Major. I'm Associate Professor at the Oklahoma College of Optometry in Tahlequah, Oklahoma, and very pleased and fortunate to have Munish here with me today.
Hey, thanks for the nice introduction, Carolyn. Yes, my name is Munish Sharma. I'm Chief of Optometry for Kaiser Permanente for San Bernardino County area. And we're really excited to share some really nice cases and a nice presentation on imaging and future of diabetic retinopathy. All right, so diabetes management on a population health perspective is a three-part problem. The first problem is, we all know it's the number one cause of blindness in people from 20 to 74 years of age. And we knew from, I will say now 50 years ago when DRS report 14 first published, that we can actually prevent the blindness in 2/3 of the patients if you're able to catch it early and manage it adequately. But at the same time, those of us who have been practicing for a few years already know that traditional screening methods that we're using right now aren't very perfect. So almost just 40% of patients who need to be screened are screened according to National Committee of Quality Assurance recommendation. So that leaves a lot that desirable that needs to be done. The second part of the problem actually is demand for diabetes care. We all know diabetes is going to increase in prevalence from 14% to 21% of population by 2050. That means the demand for diabetic retinopathy or vision-threatening diabetic retinopathy screening is going to implode in itself to 19.4 million patients by 2050. Now let's look at the supply, and we're going to talk a little bit more about it later on. There's going to be only 2% change if we just look at ophthalmologists from 2005 to 2020. So looking at it in a different perspective, let me just sum it up. So the incidence of diabetes is increasing by around 1.4 million cases per year. With the present situation in which we get around 467 ophthalmologists graduating and 1,557 optometry graduates graduating from optometry school, the ratio doesn't look very pleasing. We got a situation in which we have 2,000 new eye care professionals coming who have to manage 1.4 million newly diagnosed patients. That means we are looking at something like one eye care provider looking at around 700 patients or so a year. So that is a challenge. So today's talk is about how we can manage this. The first part of the talk will talk about how imaging can help in managing this large volume of patients coming in. So Carolyn's going to talk about the diagnosis and management by optometrists actively using new imaging modalities. And then we'll talk about how we can do population care or how we can manage the population end of it. So Carolyn, I'll have you start.